Welcome to Nursing Assessment, the Urinary System. This should really be a review of what you learned in your health assessment course. It is very essential that you understand the assessment pieces and the patho pieces first before you move on to the rest of the module, since this is very important for the entire function of the body. Adequate kidney function really is essential to maintenance of a healthy body. If complete kidney failure and treatment is not provided, death is inevitable. Really, we're going to look at structures and functions, assessment, and new, probably to you, diagnostic studies. So take your time, really get the pieces of this because it'll be important moving on. So the urinary system is really broken up. There's the upper urinary system, which is really 2 kidneys, 2 ureters, and then the lower urinary system. This is the urinary bladder and the urethra. This is important when you come to things like UTIs of where is that UTI located or that urinary tract infection located. Urine is formed in the kidneys. It drains through the ureters and is stored in the bladder and passes from the body through the urethra. Kidneys are really the principal organ of the urinary system. There's obviously other organs, but the kidneys are number one. The primary function of the kidneys regulate the volume and composition of ECF and excrete waste product from the body. So each kidney contains approximately 1 million nephrons. Nephron is the functional unit of the kidneys. Each nephron composes of the glomerulus, the Bowman's capsule, and the tubular system. So when it comes to the kidneys, the blood supply is extremely important. If you need to remember the different pathology and the anatomy and physiology, I highly recommend going back to part 0, which talks about the basics of kidney function. But the blood supply is extremely important to the kidneys and accounts for probably 20 to 25% of cardiac output, which is huge. Blood reaches the kidneys via the renal artery, which arises from the aorta and enters the kidney through the ileus. Renal artery divides into secondary branches and then into smaller branches, which each then have different arterioli to that different area. This then divides into a capillary network, which is called the glomerulus. So when it comes to the physiology of urine formation, this is again just a review. Glomerular function: blood is filtrated by hydrostatic pressure, passes through the Bowman's capsule. Glomerular filtrate passes down the tubule, and then this is where you get your GFR, glomerular filtration rate. This is normally between 110 and 125 milliliters per minute. Less than that, then you're probably going to see some kidney damage. So the glomerular filtration rate is an important thing to know. Tubular function really comes with reabsorption. Probably proximal convoluted tubule is about 80% of electrolytes. The loop of Henle is water, and descending loop is water, some sodium, urea, and other solutes. And then the ascending loop is chlorine and sodium. You don't need to know all those very specifics, but it's very important to know that there's different sections of the kidney that reabsorb different things. And then tubular secretion is the passage of the substance through the capillaries and out of the kidneys. So other important functions of the kidney include red blood cell production. This includes erythropoietin, which is a hormone that produced in the kidneys, usually secreted in response to hypoxia and decreased renal blood flow, and this stimulates the body to produce more red blood cells, usually in the bone marrow. Renin is also a very important thing because it is a regulator of blood pressure. Renin activates angiotensin to angiotensin. Angiotensin 1 is converted into angiotensin 2 by ACE, and angiotensin 2 stimulates the release of aldosterone. Usually released in the bloodstream due to response to decreased renal perfusion, decreased artery blood pressure, decreased ECF, decreased sodium concentration, or increased urinary sodium concentration. Basically, your body is like, hey, my blood pressure is not acting right due to any one of those reasons. Can you secrete more renin, which then increases the blood pressure? So the bladder, it is a reservoir for urine, usually a capacity of 600 to 1,000 mils of urine at a time. Normal adult urination output is approximately 1,500 to maybe a little bit more mils per day. Usually varies depending on food and fluid intake. Primary functions really the reservoir and to eliminate waste products from the body. The bladder muscle is a very stretchy muscle that can kind of expand depending on the amount of reservoir needed. And you can usually see it in urination, and voiding is the next step after. So the urethra extends from the bladder neck to the external meatus. It is the conduit for urine during voiding. The length of a female's is usually 1 to 2 inches, and a male's is 8 to 10 inches. You usually see, for example, that females are more likely to have a urinary tract infection. This is usually due to a shorter urethra, so that bacteria is more likely to go up the length of the urethra. And then you have the urethrovesical unit. This is formed by the bladder, urethra, and the pelvic floor muscles. Voluntary control of this unit is defined as continence. So if you have control over these, then you are continent. If you do not, then this is usually a sign of incontinence, which is talked about more in the next section. Distension of the bladder stimulates stretch receptors. Impulses are sent to the brain saying, hey, we are at max capacity. It is time to go to the bathroom. And that is an important stimulant that can decrease over time, or there's different things that inhibit that impulse, which are talked about more in the next section. So usually between the ages of 30 to 90, the size and weight of kidneys decrease by 20 to 30%. By the 7th decade, in your 70s, your loss is of usually about 50% of your glomerular function. Those who are diagnosed with atherosclerosis usually accelerate the decrease of renal size with their age. You also see a decrease of renal blood flow, which results in a decrease of GFR, and altered hormonal levels of ADH, aldosterone, and ANP, which result in a decreased ability to concentrate urine. This is usually altered excretion of water and sodium and potassium and acid, so you'll see more of those electrolyte imbalances. And then a loss of elasticity and muscle support, and for the males, prostate enlargement, which can cause some issues with hesitancy, urinary retention, slow stream, and bladder infections. So when it comes to the assessment of the urinary system, the subjective data, it's important to get the important health information. This could include past medical history. Another very important one is medications, because there are medications that can be nephrotoxic to the kidneys. They can alter characteristics of the urine, such as diuretics, change the color of urine, such as pyridium, which causes urine to kind of be this orange, really dark color. Maybe they are on anticoagulants, which causes maybe some blood in their urine, and really just different other medications. So it's important to get all medications, including herbs and over-the-counter meds. And then surgeries. What surgeries have they had? Have they had any other treatments? Any past urinary problems, especially, for example, women with past pregnancies? It's important to know. Here's just a brief list of possibly or potentially nephrotoxic agents. So important meds to know. Note that there's quite a few on here that people can take over the counter as well. So things to know, no corticovertebral tenderness. Please know how to palpate that. You want non-palpable kidneys and bladder, no palpable masses. You want to know the color and clarity of the patient's urine, any odor of the urine, and any kind of changes such as burning, urgency, maybe dribbling. There's a bunch of different terms that's important to know when you're getting a urinary assessment. So diagnostics, one of the most important is the urinalysis. This is usually the best for the first morning void. That being said, that's not always the case. Somebody comes to the emergency room or urgent care or even a PCP clinic, that you get what urine you can. It's important to accurately, correctly get that urinalysis. So it takes a lot of education to the patient of how to collect that urinalysis. Usually you want to get the urine to the lab and examined within 1 hour. So if you think, you get a urinalysis, you leave it in the patient's room for 3 hours, it was sealed, but what is brewing in that urine? Maybe your white blood cell count is off because it was sitting there for so long. So it's important to get that urine and get it down to lab. Another important one is creatinine clearance. Sometimes this is collected over a 24-hour urine specimen. So you get a big orange container, it's usually orange, big container, collect urine for 24 hours, and creatinine clearance is a close approximation of GFR. So this shows normal findings in a urinalysis. It is important to know all your normal values so that you can also see your abnormal values. So you may see test questions that are like, there are this many WCs, there are this many, what is your abnormal? So really focus on knowing the normal before you go into the abnormals. Other important blood studies to know for the urinary system is your BUN, which is used to detect renal problems, your creatinine, which is more reliable than BUN as a determinant of renal function. Creatinine is the end product of muscle and protein metabolism and is released at a constant rate, where BUN can kind of fluctuate a little bit more. Your sodium levels are important to know, and your potassium levels. Other important labs to know is your calcium, phosphorus, bicarb, and your GFR. So some other diagnostics that you can do is the IV pyelogram. This visualizes urinary tract after an injection of contrast media. Important things about contrast media is always double check for any allergies. That's a big one. But you also want to know if the kidney function is actually working, because the kidneys are one of those that processes the contrast. So you really, anytime before you give any kind of contrast, any kind of diagnostic study, you want to know the renal function. Is extremely important to remember. The IV pyelogram looks at presence, position, size, and shape of kidneys, ureters, and bladder, so they can all be evaluated. Usually they want a bowel prep before, because if you have a lot of bowel that's in the way of seeing the kidneys, you're not going to be able to see it. Again, look for allergies, flushed face, and a salty taste during the procedure. That's the biggest complaint people have. And then encourage fluids afterwards so they can flush that media, the contrast, out of them. The renal arteriogram visualizes renal blood vessels and can assist in diagnosing renal artery stenosis. As talked about earlier, blood flow is extremely important for the kidneys. So if you have some stenosis and the kidneys are not getting as much blood as needed, that is an important thing to know. Usually a catheter is inserted into the femoral artery and passed up in the aorta to the level of the renal arteries. Again, bowel prep before, iodine allergy, and then usually they need a pressure dressing afterwards because it is going through an artery. So it is important to assess for bleeding. And then a cystoscopy. This inspects the interior of the bladder with a tubular lighted scope, or a cystoscope. Complications: urinary retention, urinary tract hemorrhage, bladder infection, and perforation of the bladder. You are putting something inside the bladder. So usually you need to explain the burning or urination afterwards, pink tinged urine, and urinary frequency, usually expected because you've irritated that bladder. If they have bright red bleeding, that is not normal, and so they might be hemorrhaging or having other issues, so they need to be checked. So this actually shows the cystoscopy procedure, what it actually looks like, male versus female. They are looking with that scope into the actual bladder. So it's one of the biggest diagnostic tools when they want to look inside to see what is going on.